Most people think heart attacks announce themselves. Chest pain, pain shooting down the left arm, a sudden collapse. That's what we see in movies. That's what most people expect. But after the age of 60, some of the most dangerous heart events are the silent ones, the ones that develop gradually while you're asleep. No warning, no time to call for help, no second chance. And here's what surprises many people when we talk about this after a medical emergency. These events are often influenced by something incredibly ordinary, something that seems completely harmless, something you did just before turning off the lights. For more than 2 decades, I've cared for older adults and studied how everyday habits affect the health of the heart, blood vessels, and the body's natural defense systems. Again and again, I've seen the same patterns appear in people who never imagined that a few simple evening routines could quietly increase their cardiovascular risk night after night. Tonight, I'm going to show you 5 of those habits, 5 routines that may be placing unnecessary stress on your heart while you sleep. Then I'll show you how to replace them with simple evening choices that help support healthier blood vessels, better circulation, and a stronger heart. Stay with me. What you learn over the next few minutes could become one of the most valuable health lessons you hear this year. Here's something many people don't realize. Your cardiovascular system doesn't rest when you fall asleep. It simply changes the way it works. In a healthy body, nighttime is when blood pressure naturally falls, usually by about 10 to 20% compared with daytime levels. Your heart beats more slowly, your blood vessels relax. Your body shifts into a state of repair and maintenance that helps restore cardiovascular function before a new day begins. But after the age of 60, that process doesn't always work as smoothly. Blood vessels gradually lose some of their flexibility. The body's ability to regulate blood pressure becomes less precise. Some of the natural biological signals that once protected your heart during sleep become less efficient. And as that happens, your margin for error becomes much smaller. Think of it this way. During the day, your cardiovascular system has multiple ways to adapt to stress. It can compensate, it can adjust, it can recover, but during the night, many of those protective responses are naturally reduced. Your body is still working, but it's operating in a quieter, more vulnerable state. That's one reason the hours between midnight and 6 in the morning are associated with a higher risk of heart attacks and strokes in older adults. Not during the busy afternoon, not during the morning commute, but during the quiet hours, when your body depends on the choices you made earlier that evening. And here's the part that changes everything. What happens during those vulnerable hours is often influenced by what you did before going to bed. The dinner you ate, the medication you took or forgot to take, the amount of water you drank, even the temperature in your bedroom. Simple decisions that feel routine can have a meaningful impact on how well your heart functions throughout the night. That's exactly what we're going to explore, starting with the habit that surprises my patients the most. Let me ask you something. What time did you eat dinner last night? And what was on your plate? I ask my patients these questions all the time. Surprisingly, many people over the age of 60 tell me they eat dinner around 8 o'clock, 9 o'clock, sometimes even 10 o'clock at night. A full meal, pasta, rice, red meat, maybe something fried. Then they spend a little time watching television and head to bed within an hour or two. I completely understand why this happens. Busy schedules, family routines, habits developed over many years. But from the perspective of heart health, this evening routine may be placing more stress on your cardiovascular system than most people realize. A large meal late at night is one of the most overlooked challenges your heart can face. Here's why. After a heavy meal, your digestive system immediately requires a significant increase in blood flow. To meet that demand, your heart has to work harder. Blood pressure may rise. Blood sugar begins to increase. Triglycerides, the fats circulating in your bloodstream, also rise during the hours after eating. Now combine that with going to sleep. Your body is naturally preparing for rest, repair, and recovery. Instead of slowing down, your cardiovascular system is still working hard to support digestion. Those two processes compete with one another. And after the age of 60, when blood vessels are often less flexible and circulation isn't as efficient as it once was, that extra workload becomes much more significant. Research has consistently shown that eating within 2 to 3 hours before bedtime is associated with higher nighttime blood pressure and increased likelihood of acid reflux, which can sometimes mimic or even trigger cardiac symptoms, and poorer sleep quality, all of which can place additional strain on the cardiovascular system. Fortunately, the solution is simple. Whenever possible, Try to finish your main meal between 6 o'clock and 7 o'clock in the evening. This gives your body enough time to digest before sleep. If your schedule requires you to eat later, keep the meal lighter. Choose foods that nourish rather than overload your body. Lean sources of protein, colorful vegetables, healthy fats, and moderate portions instead of oversized meals. Your heart performs some of its most important recovery work while you sleep. Giving your digestive system a head start before bedtime allows your body to focus on restoration instead of carrying the burden of processing a heavy dinner throughout the night. So let me ask you again, does your usual dinner routine sound anything like what we've just discussed? If it does, you're certainly not alone. It's one of the most common habits I see, and it's also one of the easiest to improve. Now I want you to pay especially close attention to the next habit because for many adults over 60, it may have an even greater impact on nighttime heart health than the timing of dinner. Now I need you to pay very close attention to this next point because this is where some of the most preventable heart problems begin. If you're over the age of 60 and you take medication for high blood pressure, and statistically, many people in this age group do, the timing of that medication may be more important than you realize. It's a topic that often doesn't receive enough attention during a routine office visit. Most people know that controlling blood pressure is important. Far fewer understand that when you take your medication can also play a meaningful role in how well it protects you throughout the night. For most healthy adults, blood pressure follows a natural daily rhythm. It rises in the morning. It reaches its highest levels during the day. Then it gradually falls while you sleep. This nightly drop gives your heart and blood vessels a chance to recover. But for many adults over 60, especially those living with hypertension, that healthy pattern doesn't always happen. Instead of falling overnight, blood pressure may remain elevated. In some people, it even rises during the early morning hours. This is sometimes referred to as nocturnal hypertension, And because it happens while you're asleep, most people never know it's occurring. Yet it can quietly place extra stress on the heart and blood vessels night after night. When blood pressure remains high during sleep, the arteries don't get the period of rest they're designed to have. Over time, that constant pressure may contribute to damage inside the blood vessels, increasing the risk of heart attack, stroke, and other cardiovascular complications. The early morning hours are especially important. As your body begins preparing to wake up, hormones naturally increase blood pressure and heart rate. If your blood pressure is already elevated before that happens, it may place even greater strain on an aging cardiovascular system. This is why medication timing deserves a conversation with your healthcare provider. If you take your blood pressure medicine only in the morning, its effect may be reduced during the hours when your body needs support the most. On the other hand, changing the timing without medical guidance isn't the answer either. The right schedule depends on the specific medication you're taking, your medical history, and your doctor's recommendations. So here's what I encourage every patient to do. At your next appointment, ask one simple question. Is the timing of my blood pressure medication the best choice for protecting my heart overnight? That conversation takes only a minute or two, but it could help your treatment work more effectively. Several clinical studies have suggested that, for some patients, taking certain blood pressure medications in the evening may improve overnight blood pressure control and reduce cardiovascular risk. However, this approach is not appropriate for everyone, which is exactly why it's important to make that decision together with your physician. One thing is certain, never assume that timing doesn't matter. When it comes to protecting the heart, small details often produce the biggest results. And surprisingly, many people over the age of 60 have never had this conversation with their doctor. Now let's move to another nighttime habit that quietly affects millions of people, yet many still think it's nothing more than an annoying sound: snoring. Now I want you to think about someone you know who snores. Maybe it's your spouse, maybe it's one of your parents, or maybe it's you. That loud, uneven sound during the night is often treated as a joke, something people laugh about, something that earns a gentle nudge from the person sleeping beside you. But from a medical perspective, persistent loud snoring deserves much more attention. In many cases, it can be an important warning sign that your body isn't getting the oxygen it needs while you sleep. After caring for patients for more than 2 decades, I've learned never to dismiss it too quickly. One of the most common reasons behind heavy snoring is obstructive sleep apnea, It's estimated that millions of older adults are living with this condition, and many have never been diagnosed. They wake up each morning believing they slept through the night, without realizing that their breathing may have stopped dozens of times while they were asleep. Here's what actually happens. During an episode of sleep apnea, the airway temporarily becomes blocked. Breathing may stop for 10 seconds, sometimes even longer. This interruption can happen again and again throughout the night. Each time it does, oxygen levels begin to fall. Your brain recognizes the drop and immediately sends out an emergency signal. Stress hormones such as adrenaline are released. Your heart rate suddenly increases. Blood pressure rises. Your body briefly wakes itself just enough to restart breathing, even though you may have no memory of it the next morning. Imagine putting your heart through that cycle 30 or even 50 times in a single night, night after night, year after year. It's easy to understand why sleep apnea has been linked to a significantly higher risk of cardiovascular disease. Research has associated untreated sleep apnea with an increased risk of high blood pressure, heart attack, stroke, irregular heart rhythms such as atrial fibrillation, and heart failure. It also contributes to ongoing inflammation and damage within the blood vessels, making it much harder for your cardiovascular system to recover during sleep. The challenging part is that many people don't recognize the warning signs. Yes, loud snoring is one of them, but there are several others that deserve your attention. Do you wake up with headaches? Do you feel exhausted even after what should have been a full night's sleep? Do you wake up several times to use the bathroom? Do you often have a dry mouth in the morning? Has anyone ever told you that you stop breathing, choke, or gasp during the night? If any of those sound familiar, don't ignore them. Talk with your healthcare provider about whether a sleep evaluation is appropriate for you. A simple sleep study can often provide answers that routine checkups cannot. If sleep apnea is diagnosed, treatment can make a remarkable difference. For many people, the most effective therapy is a CPAP device, which gently keeps the airway open throughout the night. It may take some time to get used to, but the benefits are well documented. People who consistently use CPAP often experience better sleep quality, improved blood pressure control, lower rates of abnormal heart rhythms, and a reduced risk of future cardiovascular events. One treatment, one nightly habit, a meaningful investment in your long-term heart health. So let me ask you something. Has anyone ever told you that you snore loudly or that you stop breathing while you're asleep? If the answer is yes, don't simply brush it aside. Your body may be trying to tell you something important. Now let's look at another evening habit that seems perfectly reasonable at first, but may quietly increase your heart's workload while you sleep. Now, let's talk about another habit that many people over 60 do without realizing it could affect their heart. They stop drinking water in the evening to avoid waking up during the night to use the bathroom. It sounds like a sensible idea, but going to bed even mildly dehydrated can make your blood more concentrated, forcing your heart to work a little harder to keep it circulating. During sleep, your heart rate naturally slows, and blood flow becomes slower. If you're also dehydrated, especially after the age of 60, it can place additional strain on your cardiovascular system. The good news is that the solution is simple. Drink ***1 moderate glass of water, *** before going to bed. Not too much, just enough to stay well hydrated. You can also keep a glass of water beside your bed in case you wake up feeling thirsty. Of course, if your doctor has advised you to limit fluids because of a medical condition such as heart failure or kidney disease, always follow their guidance. The goal isn't to drink excessive amounts of water. It's simply to avoid going to bed dehydrated. This one small habit can help support healthy circulation while you sleep. Now let's look at another simple change that can make a surprising difference: the temperature of your bedroom. Now, here's another habit that surprises many people because it seems far too simple to matter.
***.
The temperature of your bedroom. Most people think it's only about comfort, but while you sleep, the temperature around you can influence how hard your heart has to work. If your bedroom is *** too warm, above about **22 degrees C, 72 degrees Fahrenheit, your body has to work harder to cool itself. Your heart rate may stay slightly elevated, you lose more fluids through sweating, and your sleep becomes lighter. That means less time in the deep stages of sleep, when your heart and blood vessels do much of their overnight recovery. On the other hand, if your room is ** too cold, below about **16-17 degrees C, 61-63 degree F, your blood vessels tighten to conserve heat. This can raise blood pressure and make your heart work harder. especially if you're over 60 or already have cardiovascular disease. So what's the ideal temperature? For most people, keeping the bedroom between * 18 and 22 degrees Celsius, 65-72 degree F **, provides the best environment for restful sleep and healthy circulation. Your heart rate stays steady, your blood vessels remain relaxed, and your body can focus on repair instead of temperature regulation. Sometimes the simplest changes make the biggest difference. Adjust the thermostat if needed. Use lighter bedding when it's warm, add an extra blanket if it's cold. These small adjustments take only a few moments, but they help create the ideal environment for your heart to recover overnight. And when you combine this habit with the other 4 we've discussed, you create a simple evening routine that supports your heart every single night. Let's put that routine together. Everything we've discussed may seem like a lot to remember, but when you put these 5 habits together, they become one simple evening routine to help protect your heart while you sleep. Here's what that looks like. ***, around 6 o'clock to 7 o'clock p.m. ***. Eat your main meal. Keep it balanced and avoid heavy dinners close to bedtime, so your body has time to digest before sleep. ***, after dinner ***, drink a moderate glass of water and take your medications exactly as prescribed. If you take blood pressure medication, ask your doctor whether the timing you're using is the best for you. ***, between 8 o'clock and 9 o'clock p.m. ***, begin winding down. Take a short walk, read, or enjoy a quiet activity. Limit bright screens to help your body prepare for restful sleep. ***, before bed ***, make sure your bedroom is cool and comfortable, and keep a glass of water nearby in case you wake up feeling thirsty. If you snore or have been told you stop breathing during sleep, try sleeping on your side while arranging a proper medical evaluation. That's it. A balanced dinner, proper hydration, take your medications as directed, a relaxing evening, a cool bedroom, and healthy sleep. These aren't dramatic changes, but together they create the right conditions for your heart to recover and perform at its best every night. The question isn't whether these habits can help. The real question is, ***, will you start practicing them tonight? Before we finish, I want you to remember one simple message. Heart health isn't built by one big decision. It's built by the small choices you make every day and every night. Let's quickly review today's 5 habits. ***. First ***, finish your dinner by ***, 6:00 or 7 o'clock p.m. ***, whenever possible. Second ***, talk with your doctor about whether the timing of your blood pressure medication is right for you. Third ***, if you snore heavily or often wake up exhausted, ask about being evaluated for sleep apnea. Fourth ***, don't go to bed dehydrated. A moderate glass of water before bed can help support healthy circulation, unless your doctor has advised you to limit fluids. And fifth ***, keep your bedroom cool, ideally between * 18 and 22 degrees Celsius, 65-72 degree F ***, to help your heart and body recover during sleep. These are simple habits, but together they can make a meaningful difference over time. Now I'd love to hear from you. Which of these 5 habits will you start working on tonight? Leave your answer in the comments below. I read as many as I can. If you found this video helpful, please share it with someone you care about. It may encourage them to build healthier evening habits too. And if you enjoy practical, science-based tips for healthy aging and protecting your heart naturally, don't forget to subscribe and turn on notifications. Thank you for watching. Take good care of yourself, sleep well, and I'll see you in the next video.